Can you comment on the devastation or the impact of diabetic foot ulcers on individual patients, just to kind of give us an idea as to how this impacts a patient's life?
The presence of a diabetic ulcer is like sirens going off that should be telling people that they've gotten to the point in their healthcare where they're sick. They have changes in their ability to heal. The risk of a diabetic foot ulcer is not just the ulcer itself and the infection and possible amputation. It's that you have some serious things going on that need to be attended to. The death rate within 5 years of onset is greater than several types of cancer and certain types of conditions, breast cancer and other cancers that we have get a lot more notoriety in the population.
A lot of these people have a very fragile economic situation. These people have to work, they're the working poor. And so these people have to be able to get to work, because a lot of them, if you don't work, you don't get paid, you don't have health insurance, you don't pay the bills. So we try to work with these people. Bottom line here is that diabetes is a family affair. There's a guilt factor, and I really feel that people do not appreciate this. So the patient has guilt asking their family to drive them around to all their doctor's appointments, and that could be family doctor, endocrinologist. A lot of them have kidney issues, so it's urologists. They have eye issues, so they have to see the ophthalmologist. So it goes on and on. So they're embarrassed about it. Then the family members, they're like, it's an awkward situation. They can't say no, take the van service. And so not that I want them walking around at work, but at least with the something like the Force insole, they can actually go to work. But if you have a Force on, I still don't want my patients to drive, but I just say, hey, just put a stiff sole shoe on when you drive, and then just take it off and put your Force back on.
On my way home tonight, I had to do a house call and stop in to see a patient of mine. And he called me up today and was, is my toes turning black? I don't know what to do. And so I stopped by, and, he basically was at the point of wet gangrene and ascending cellulitis. And I said, when did you start feeling this? And it was like several days ago, we mowed the lawn for 3 hours. And then he started getting shaking chills. And then he started getting, he could smell something. You just don't sit and wait and hope things are going to get better. You intervene and you do something quickly. You call your doctor, you go to the emergency room, you go, and he just didn't perceive that this was going to progress to something so drastic. We have to try to get across to the patients that, one, that offloading is important. Two, all care is important. Managing your sugars, taking care of your situation, to being proactive about your health care, and then doing your very best to notice small changes and be proactive in your care.